Meantime, the Ministry of Health continues to emphasize the message of prevention now that it's recorded the first case of Zika here in the country. The chief medical officer spoke with our Carla Palmer earlier today.
With time, we will not be overly surprised that we will not have a case.
That pronouncement made this past Friday by Chief Medical Officer at the Ministry of Health, Dr. Glenn Benaby, a sober reality just days later, as he confirmed to ZNS News on Wednesday the first case of the Zika virus here in the Bahamas.
His symptoms included rash, fever, joint pains, and headache, for which he sought medical attention at a private medical facility. A sample of blood was taken for testing and sent to a reference laboratory. A confirmed positive result was received on Tuesday, August 9, 2016.
Described as the first primary case of Zika, the Bahamian male in his 40s who lives in New Providence is reported to have recently returned home from Jamaica.
The patient has been treated for associated symptoms and is recovering.
The first primary case reportedly resides right here in the Pinewood Gardens community. As a result, health officials say the surveillance team at the Department of Environmental Health will now do due diligence.
Now that a case has been confirmed, the fogging and increased initiatives will occur in the particular community where he resides.
The Zika virus is transmitted primarily by the bite of an infected Aedes aegypti mosquito, the same mosquito health officials say that transmits dengue, chikungunya, and yellow fever viruses. The virus can also be passed from mother to baby and through sex. There is no specific treatment or vaccine available for Zika as yet, and so now health officials emphasize the best form of protection is prevention.
Prevention measures include avoiding mosquito bites by applying mosquito repellent on exposed skin, wearing long-sleeve light-colored clothing, completely screening all doors and windows, and other measures include elimination of mosquito breeding sites in and around living spaces.
For further information, residents are being asked to call the National Disease Surveillance Unit at numbers 502-4776, 502-4790, 376-3809, or 376-4705. Carla Palmer, ZNS Network News.